This lecture is about joints of the lower limb. The main features of the synovial joints that should be described are bones, articular surfaces, articular or joint capsule, ligaments, and movements. The articular capsule consists of two different membranes. It consists of fibrous membrane, it is outer, white-colored, strong membrane, constructed of fibrous tissue, and the most usually, the fibrous membrane is attached to the peripheral border of the articular surfaces. On the other side, synovial membrane is very thin membrane. It is inner membrane. It covers internal surface of the fibrous membrane, and also it covers all bony structures located inside the joint that are not covered by an articular cartilage. So we can say that synovial membrane covers all bony structures located inside the joint that are not articular surfaces. Synovial membrane also produces synovial fluid. The first synovial joint of the lower limb that I will explain to you is the hip joint. It is a ball and socket type of synovial joint between the head of the femur and acetabulum of the hip bone. This joint is the largest ball and socket type of joint in the body. The hip joint connects proximal end of the femur and hip bone. Articular surfaces are head of the femur and acetabulum located at the lateral surface of the hip bone. The head of femur forms more than half of a sphere. It is covered by the articular hyaline cartilage, except for a small pit. The fovea of head of the femur, or fovea capitis, for ligament of head of the femur. As I said before, the acetabulum is located at the lateral surface of the middle constricted part of the hip bone. It presents four features. The peripheral border is named acetabular margin, a horseshoe-shaped lunate surface. In the middle is located acetabular fossa, and below fossa is located acetabular notch. The lunate surface is only articular and covered by an articular cartilage. The depth of the acetabulum is increased by the acetabular labrum. Here are articular surfaces of the hip joint once again. They are head of the femur and lunate surface of the acetabulum of hip bone. Articular surfaces are covered by hyaline articular cartilage. Beside articular surfaces, here you can see two intra-articular ligaments. Why intra-articular? Because they are located inside the joint, below the fibrous membrane of the articular capsule. Intra-articular ligaments of the hip joint are transverse acetabular ligament. It is a part of acetabular labrum which bridges the acetabular notch. Another ligament located inside the joint is ligament of the head of femur. It is a flat triangular ligament with apex attached to the fovea of the head of the femur and its base to acetabular notch. The articular capsule surrounds articular surfaces. it consists of two membranes. It is a fibrous outer membrane and synovial or inner membrane. Beside the intra-articular ligaments, ligaments of the hip joint consist of two sets of fibers, circular or deep and longitudinal or superficial fibers. The circular or deep fibers surround femoral neck and form structure named zona orbicularis. Longitudinal or superficial fibers form three different ligaments named iliofemoral ligament, ischiofemoral ligament, and pubofemoral ligament. The iliofemoral ligament is inverted Y-shaped ligament. It lies in front of the articular capsule and at the anterior surface of the joint. Its apex is attached to the anterior-inferior iliac spine. The transverse part of the iliofemoral ligament attached to the upper part of the intertrochanteric line, while the descending part of the iliofemoral ligament is attached to the lower part of the intertrochanteric line. Pubofemoral ligament is a triangular ligament. Its base is attached to the iliopubic eminence. Inferiorly, it is attached to the lower part of the intertrochanteric line. And the last longitudinal ligament is ischiofemoral ligament. It is attached to the ischium at the point below and behind the acetabulum. From ischium, its fibers spiral behind the femoral neck to be attached into the greater trochanter deep to the iliofemoral ligament. The hip joint is a ball and socket synovial joint. Its range of movements is restricted due to its role in weight bearing. The movements of the hip joint are flexion, extension, adduction, abduction, lateral and medial rotation, and circumduction. Here are some examples of movements at the hip joint. You can see flexion, extension, adduction, medial and lateral rotation. Movements could be passive and active. Branches of deep femoral artery form vascular network around hip joint. Their names are lateral circumflex femoral artery and medial circumflex femoral artery. The branch of the obturator artery passes through the ligament of head of the femur and supplies head of the femur. Beside hip joint, the joints of the lower limb include knee joint, tibiofibular joints, ankle joint, and foot joints. The knee joint is the largest and most complicated joint in the body. It is the major weight-bearing joint in the body. It is a synovial joint of modified hinge variety. The knee joint connects proximal end of tibia and distal end of the femur. At the anterior side of this joint is patella or knee cap. Articular surfaces of the knee joint are superior articular surface of tibia lateral and medial condyle of femur, and articular surface of patella. The superior articular surface of tibia consists of two smaller articular surfaces that belong to medial and lateral condyle. These articular surfaces are slightly concave. Between them is located intercondylar area. Intercondylar area is divided in three parts. They are anterior intercondylar area and posterior intercondylar area. They are rough. The third intercondylar part is prominent. Its name is intercondylar eminence. Intercondylar eminence consists of two intercondylar tubercles, lateral and medial. Articular surfaces of the lower end of the femur are medial and lateral condyle and patellar surface that articulates with articular surface of patella. Articular surface of patella is located at its posterior surface. Between articular surfaces of the tibia and femur, the two fibrocartilaginous structures, medial and lateral meniscus, are inserted. Each meniscus has two ends, anterior and posterior, which are attached to tibia. They have two borders. The thick outer border is fixed to the fibrous capsule, and the thin inner border, which is free. They have two thin surfaces. The upper surface is concave for the femur, and the lower surface is flat for the peripheral 2/3 of tibial condyles. The lateral meniscus is circular in shape, while medial meniscus is semilunar in shape. Here you can see superior concave surface of meniscus for the femur. Each meniscus has two ends, anterior and posterior. They are attached to tibia, to intercondylar areas, anterior and posterior. Each meniscus has two borders, the thick outer border and the thin inner border. Inner border is free border. They have two thin surfaces. Superior surface is concave for the femur, and you can see this surface in this figure. Here you can see one part of cruciate ligaments. These ligaments are thick, strong fibrous bands which act as direct bonds of union between the femur and tibia. They are present inside the knee joint. Cruciate ligaments maintain anteroposterior stability of the knee joint. They are named anterior and posterior according to their site of attachment of the tibia. The cruciate ligaments are intracapsular but extrasynovial. It is very important to remember that cruciate ligaments are intracapsular but extrasynovial. The ligaments cross each other like the letter X, hence the name cruciate. As usually, the articular capsule consists of synovial and fibrous membrane. The knee joint is the biggest joint in the body. Anterior and posterior ends or horns of the lateral and medial meniscus are attached to the intercondylar area of the tibia. Once again, articular surfaces of the knee joint are two condyles of the lower end of the femur, lateral and medial condyle, and patellar surface. At the upper end of tibia, articular surfaces are also located at the lateral and medial condyle. And the last articular surface of the knee joint is articular surface of patella. Synovial membrane of the articular capsule together with patella form lateral and medial suprapatellar and infrapatellar recesses. Aspiration of the knee joint always should be performed through the lateral suprapatellar recess. Here you can see aspiration of the knee joint through the lateral suprapatellar recess. The ligaments of the knee joint are divided in two groups: internal or intracapsular and external or extracapsular ligaments. Internal or intracapsular ligaments are anterior and posterior cruciate ligament, transverse ligament of the knee joint, and anterior and posterior meniscofemoral ligament. They are permanent ligaments of the knee joint, but in some cases could be present non-permanent ligaments. Their names are meniscofibular, meniscotibial, and meniscopatellar ligaments. The cruciate ligaments are intra-articular and intracapsular ligaments that are covered with synovial membrane. Because of that, they are extrasynovial. The anterior cruciate ligament is attached below to the anterior intercondylar area of tibia. Upper part of the anterior cruciate ligament is attached to the medial surface of the lateral condyle of femur. The posterior cruciate ligament is attached below to the posterior intercondylar area of the tibia, while upper part of the posterior cruciate ligament is attached to the lateral surface of the medial condyle of the femur. You can see that cruciate ligaments cross each other like the letter X, and because of that, they are called cruciate ligaments. The posterior horn of the lateral meniscus is attached to the medial condyle of femur by the anterior and posterior meniscofemoral ligaments. The anterior meniscofemoral ligament passes in front of the posterior cruciate ligament, while the posterior meniscofemoral ligament passes behind the posterior cruciate ligament. These ligaments play an important role in regulating the movements of lateral meniscus during the extension of the knee joint. The last intra-articular ligament is transverse ligament. It extends transversally and connects the anterior ends of the medial and lateral menisci. In some cases, this ligament could be absent. In this figure, you can see very well that the posterior horn of the lateral meniscus is attached to the medial condyle of femur by the anterior and posterior meniscofemoral ligament. The anterior meniscofemoral ligament passes in front of the posterior cruciate ligament, while posterior meniscofemoral ligament passes behind the posterior cruciate ligament. The external ligaments of the knee joint are divided in three groups: anterior, overside, and posterior. Anterior ligaments of the knee joint are patellar ligament, lateral and medial retinaculum. Overside ligaments are fibular and tibial collateral ligament. And the last group are posterior ligaments. Their names are oblique and arcuate popliteal ligament. The patellar ligament is actually the tendon of insertion of quadriceps femoris muscle, which extends from the apex of the patella to the upper part of the tibial tuberosity. Tibial collateral ligament is a strong, long, and thick band of fibrous tissue. It is attached to the medial epicondyle of the femur, just below the adductor tubercle. Below, it is attached to the medial surface of the upper end of the tibia. Fibular ligament, fibular collateral ligament, is a short and cord-like ligament. Above, it is attached to the lateral epicondyle of the femur, while below it is attached to the head of fibula in front of its apex. The posterior extra-articular ligaments of the knee joint are oblique popliteal ligament and arcuate popliteal ligament. Oblique popliteal ligament is an expansion from the tendon of semimembranosus muscle. It runs upward and laterally, superficial to the capsule, to be attached to the intercondylar line of the femur. Arcuate popliteal ligament is a Y-shaped fibrous band. The stem of the band is attached to the apex of the fibula. The large posterior limb is attached to the posterior border of the intercondylar area of the tibia. The small anterior limb is attached to the lateral condyle of the femur. Knee joint is a bicondylar type of joint. It is one of the strongest and most complex joints. It is the biggest joint in our body. Movements of this joint are extension, flexion, medial and lateral rotation. Rotation is possible only during the semiflexion of the knee joint. Here are examples of the flexion, extension, and medial rotation during semiflexion of the knee joint. Branches of the femoral, popliteal, and anterior tibial artery form articular vascular network of the knee joint. The ankle joint is a strong weight-bearing joint of the lower limb. It is a synovial joint of hinge variety. The ankle joint connects inferior ends of tibia and fibula and upper surface and sides of the body of talus or ankle bone. Articular surfaces are located at the lower end of tibia and fibula and also at the superior surface of body of talus. At the tibia, articular surfaces are inferior articular surface and articular surface of the medial malleolus. At the fibula, articular surface of the lateral malleolus. And articular surface of talus is trochlea of talus. Trochlea of talus has three different surfaces: superior articular surface, medial articular surface, and lateral articular surface. The inferior articular surface of tibia articulates with superior articular surface of trochlea of talus. The articular surface of the lateral malleolus articulates with lateral articular surface of trochlea. And articular surface of the medial malleolus articulates with medial articular surface of trochlea. This joint is synovial and also has articular capsule. Articular capsule consists of fibrous and synovial membrane. The ligaments of this joint are divided in medial and lateral group. The medial ligament is named deltoid ligament because of its shape. The medial or deltoid ligament consists of two layers, superficial and deep. Superficial layer presents tibio-navicular and tibio-calcaneal ligament. Deep layer presents anterior and posterior tibio-talar ligament. The lateral ligaments of the ankle joint are anterior talofibular ligament, calcaneofibular ligament, and posterior talofibular ligament. The movements of the ankle joint are dorsal flexion and plantar flexion. The joints of the foot are intertarsal joints, transverse tarsal joint, tarsometatarsal joints, intermetatarsal joints, metatarsophalangeal joints, and interphalangeal joints. There are two joints between the talus and calcaneus, or ankle and heel bone. Their names are posterior talocalcanean joint and anterior talocalcaneo-navicular joint. The posterior talocalcanean joint is named subtalar joint. Between subtalar joint and talocalcaneo-navicular joint is present tarsal sinus. Transverse tarsal or mid-tarsal joint consists of the calcaneocuboid and talocalcaneo-navicular joint. Medial part of this joint is talocalcaneo-navicular, while lateral part is calcaneocuboid joint. The both joints are placed nearly in the same transverse plane. Tarsometatarsal joints are plain type of synovial joints. They are connected by dorsal, plantar, and interosseous tarsometatarsal ligaments. These joints permit only limited gliding movements.